Hello students, welcome. We are here with an interesting video. This time it is on the blood test reports. Have you noticed that when you get sick, most of the time, the doctor orders to test the blood? Do you know why doctors do this? Do you know what is written in a blood test report? Let us watch the video to understand why testing the blood is important in diagnosing the disease. Blood is a vital fluid circulating throughout the body, delivering oxygen, nutrients, and hormones to cells and removing waste products. It also plays a key role in the immune system, fighting infections and foreign invaders. Since blood transports most of the important elements such as nutrients, hormones, blood cells, it is used in measuring the amount of these important elements in our body. Blood tests are a common medical test that helps doctors diagnose various health conditions. They involve taking a sample of blood from a vein in your arm, which is then sent to a laboratory for analysis. In a laboratory, the blood is analyzed for various parameters. One of the most important parameters is the complete blood count, CBC, which measures the levels of red blood cells, white blood cells, and platelets in the blood. Red blood cells are responsible for carrying oxygen throughout the body, while white blood cells help fight infections and platelets help with blood clotting. If any of these parameters are abnormal, it can indicate a potential health problem. Another important parameter measured in blood tests is the blood glucose level, which measures the amount of sugar in the blood. High levels of blood glucose can indicate diabetes, while low levels can indicate hypoglycemia. Additionally, cholesterol levels are often measured to indicate the risk of heart disease. Measuring hormone levels in the blood can help diagnose a range of conditions, including hormonal imbalances and endocrine disorders. Common hormones measured include thyroid-stimulating hormone, cortisol, and testosterone. Abnormal levels of these hormones can indicate conditions such as underactive or overactive thyroid gland, Addison's disease or Cushing's syndrome, and low or high testosterone levels. Let us see an example to understand how blood tests are analyzed and help in understanding the disease a patient might be suffering from. One common use of blood tests is to diagnose infections. When a patient presents with symptoms such as fever, fatigue, and body aches, doctors may order a blood test to check for signs of infection. One key parameter measured in a blood test is the white blood cell count. If the white blood cell count is elevated, it may indicate the body is fighting off an infection. Depending on the specific type of white blood cell that is elevated, doctors may be able to narrow down the type of infection and determine the appropriate treatment plan. For example, an elevated level of neutrophils, a type of white blood cell, may indicate a bacterial infection, while an elevated level of eosinophils may indicate a parasitic infection. By measuring white blood cells in a blood test, doctors can quickly and accurately diagnose infections and provide appropriate treatment. Similar to white blood cells, measuring other parameters helps doctors diagnose a wide range of health conditions and create a treatment plan. Hoping you liked the video. Stay tuned for more such videos to become a practical student.